The chairman of the Presidential Task Force, honorable ministers, members of the Presidential Task Force, gentlemen of the press, good evening. So today I would like to address the issue of misinformation with regards to COVID, and particularly the perception that COVID infects only certain populations. As mentioned earlier by the chairman, COVID has no respect for anybody. It's a very egalitarian virus that believes in the principle of equality. It's ready to infect anybody. It's certainly not a virus that discriminates. It doesn't know whether you are rich or poor, healthy or not. And it is absolutely not an elite disease. We know of many that are poor that have been infected with the virus. We know of many in the rural areas that are getting sick from COVID, while many have contracted it and are not even aware that they've had it. This is why it is important for us to continue to be vigilant and take steps to protect ourselves. There's no doubt that people are tired of COVID. There's no doubt that we are all tired of the pandemic. It has gone on for quite a while. But remember, the virus does not tire. It is not fatigued. It is looking for any opportunity to infect us. We should not give it that opportunity. It's important that we continue to ensure citizens' safety by prioritizing and ensuring that we follow the guidelines provided by the PTF on this. The other issue I wanted to talk about briefly is the issue of communications and strategy change with regards to this. As you are aware, through our risk communication pillar, we continue to do weekly polls, NOI polls, targeting thousands of Nigerians, both at the national and specific state levels. The PTF will be adjusting its communications approach and sensitization strategy based on our polling data and grassroots intelligence. We are trying to reach more and more Nigerians with life-saving information to mitigate the COVID infection. We are also trying to change people's behavior and ensure that the best preventive measures are applied across board by all of us. In this regard, the National Orientation has been conducting community mobilization and sensitization programs in the hotspot local government areas linked with high burden of the disease. This includes sensitization on the use of face masks in motor parks for drivers and passengers, motorized campaigns in markets, door-to-door public awareness campaigns, as well as advocacy to community leaders. The private sector is a potent partner in this regard, and we continue to work with them to utilize their structures, especially when it comes to the social media, and to share data-driven messaging and behavioral change information to the grassroots. The task force is also partnering with the Federation of Muslim Women's Association and the Christian Associations of Nigerian Women to support our aggressive approach towards behavior change at the grassroots. I would also like to mention the critical partnership with other major radio stations, including Voice of Nigeria, Radio Nigeria, Wazobia, Ray Power, and a lot of others, too numerous to mention, in order to develop COVID-related programming that features COVID survivors, religious and traditional leaders, frontline healthcare workers, and other members of the public, so that we can foster a dialogue around COVID-19 and address some of the misinformation as regards whether or not COVID exists and whether or not it is really a health issue. It is only by working collectively and together that we can beat this disease. Finally, as mentioned by the chairman, next week we will be addressing the issue of Salah. We will be liaising with our religious leaders and build on the guidance we have already provided for places of worship to come up with a clear advisory on how Nigerians should best conduct themselves during this festive occasion so that they remain safe and we all remain safe. We will also be providing a summary of achievements by our key partners, including COVID, in line with our transparency principles. Thank you.